My name is Dr. Jeff Bill, and I'm the founder and CEO of Sunrise Treatment Center. After I finished my family medicine residency in the summer of 2006, I returned to my hometown on the west side of Cincinnati to begin private practice. At that practice, there was another physician who was already certified to prescribe Suboxone to treat people for problems with pain pill and heroin. Since she was leaving the practice, she asked if I would go ahead and do the training so I could continue their care. For the next year, I tried to provide those services out of that family practice. But all along, I thought that if I could find a space to really focus just on the addiction care alone, that it would work out much better for the patients that I was trying to serve. And with that, a year later in October of 2007, Sunrise was born. In the years after I founded Sunrise, I sought out more and more experiences working with other organizations to provide medication-assisted treatment. What I noticed was that the offices were mainly focused on the clinical services and didn't have as much involvement from the medical side. From my perspective, since we were using medication to help people with their substance use disorder, I thought that it should be an office that looks and feels and runs like any other office where any other chronic disease process is being managed.
I think it's really important that a patient gets a full medical evaluation when they first walk in the door. We all know that everyone is presenting with a substance use disorder of sort, but really we need to know who they are as a person, where they're coming from, what other medications they take, the social history, where they're living, who they live with, things about their family. It's just very good to know any kind of medical conditions they might have, which could affect their care. In particular, hepatitis C, that's something we see very often, that's something we treat at Sunrise. A lot of times patients will come here and they've been told over the years that they have hepatitis C, but no one's ever offered to treat it. Or they will have been referred to a GI doctor or infectious disease doctor, and it takes so long to get in, they oftentimes don't even go. So that's one important medical condition that we screen for with every patient that walks in the door. That's another reason why it's very important to get a full medical evaluation.
The counseling part of recovery is critical to the change process because you're looking at, longer term processes with behavior change. So if somebody comes into treatment and they are immediately addressing the medical component of physical withdrawal symptoms or needing to be on medication-assisted treatment, then you can think of that as a short-term objective, and then the counseling is more of the long-term objective. So it takes a while to establish the therapeutic relationship in order to build trust with your counselor, and it doesn't occur overnight. It takes a while to really work through some of those behavior changes that need to occur.
Every client, when they first come in for an intake as a new patient, will see the nurses, and the nurses educate them on the medication that they're taking if they are taking medication. They instruct them how to take it, where to store it, and things like that, what to expect. And the nurse practitioner or the physician will also give that information while they're meeting with the patient, but the nurses kind of reinforce that information and make sure that there's understanding. The nurses will draw labs on a client, usually at intake and then every 6 months to monitor certain levels. But you will see the nurse every week that you come in because the nurses dispense the medication directly to the clients. And then you get medication to take home, but the nurses are there at the window every week to dispense medication.
If someone needs a higher level of care, if they can't stabilize at the outpatient level, if they no longer have the resources in their community or in their home life to be able to put together a couple days of sobriety and then a couple more, then we need to have a plan in place to offer them that help and that support, and that's what PHP does. It provides that support, and then we provide the housing to keep them safe day to day until they can accomplish this more successfully without that extra support.
What makes Sunrise different from the other providers here is we have a very tight-knit staff. Our staff we'll each stop individually to make sure whatever each client needs they get. We have a more home environment for our clients. It's not, it's a clinical feel, but we still want them to be able to have long-term success. So we have the program built to where they have the step down. They go from 2.5 to the 2.1 to outpatient. They have the options of having case management services. They get a full, well-rounded community built behind them. So when they're finally finished, however long that takes, they have a big community behind them.
When patients arrive at our locations, they can expect a very clean and professional environment. Coming into the doors, into the waiting room, the furniture is well kept, it is organized, it's not in disarray. We have color palettes that match all of our locations. The artwork we put on the walls is very nice. Many of our locations have inspirational artwork, and other ones just have very nice scenes in them. We're proud of the work that we do, so we have our certificates all framed and our licenses and certifications clearly displayed for our patients. So from just start to finish, it's a very professional, clean, well-run experience for the patient.